Hello, everyone, and welcome to the Heart of Innovation. Dr. Phillips has the Saturday show off today. He is off saving the piggies somewhere in the world, but we are very lucky today that we are live at a very special conference, a CLI conference in El Paso, Texas. And it is a conference that's put together by Dr. Laiq Raja and his team from the Limb Savers Society. Welcome, Dr. Raja, and thank you. I'm actually speaking at the conference as well later this afternoon.
Yes, thank you very much for inviting me, and we are excited and looking forward for you to come and be part of that.
So before we get started with diving into what the Limb Savers Society is and what we're covering today in this conference, how about a moment of inspiration?
Yes, so you asked me to say something, some sort of a code, and it happens very frequently in the operating room when I'm doing some very complicated peripheral vascular limb salvage kind of a case. I would say fail fast, but refuse to lose. What does that mean? Is
Yes, I
that,
was just going to say, what does that mean?
yeah,
I kind of have an idea, but especially for patients that are listening, thinking, fail fast. No, if I want you to fail at all.
right. So the meaning is that, when we are doing an occlusion and you're unable to get through to it. So I say fail fast. Don't spend too much time of doing something which is not working. Do to second option or third option or fourth option. But the bottom line is that you that way save time and don't get exhausted just doing something which is not working. So that's why I say fail fast, but refuse to lose. At the end, you are successful in treating that patient and completing the procedure.
I love this actually, and this is pretty much going to set the stage for the rest of the show and why it's so important to hold a conference like this and to spread the word of what's possible in opening up the leg arteries. So what we're addressing is a disease that is more prevalent and deadlier than prostate cancer, breast cancer, and colon cancer combined. It's called peripheral artery disease, and it's poor circulation in mainly the legs. Amazing, talented doctors such as Dr. Laiq Raja have learned advanced skills, use advanced tools and techniques in order to open up even the most complex artery blockages in the legs. And so what he's saying is there are so many doctors that will sit there and they'll take wires and balloons and stents, and they might poke into your groin, into the artery from the groin area with a wire and balloon, and they'll take wire after wire after wire and try and poke through the blockage and poke through the blockage coming down from the top. But why are you spending your time doing this over and over and over again when, wait a minute, is there a plan B? What if we approach this blockage, this same blockage, coming up from below, what we call a retrograde approach? Antegrade is coming from the top, retrograde is coming up from the bottom, and they can access some of those really small arteries in many cases, poking into the foot or into the calf, even behind the deep knee, right, Dr. Raja?
Exactly. That's exactly what I meant. That just don't waste your time. If you start anti-grade and there are many times it's not that your skills are not good. It's just that the plaque, the occlusion sometimes are too hard and you're just unable to get through. So just don't waste your time. Fail fast, but then go to plan B, go retrograde axis or some other approach, and eventually succeed in helping that patient. It's very important because there are many times when I see, and many of our other colleagues see patients who have severe peripheral vascular disease to an extent. They have wounds and gangrene, and actually many of them are already been recommended to have amputation of the leg. So if we don't succeed in fixing that, the other next option is amputation. So that's what I say, fail fast, but refuse to lose. It
And
might take 3 weeks, 3 hours, or 4 hours, but
yep.
you have to keep trying until you're successful.
And so many doctors will just go ahead and fail fast because they'll go down, they'll take the antegrade approach, they'll approach the blockage from the groin, they'll stop at the knee, they'll say, I can't do anything more. I can't treat those small vessels below the knee at all. Just not possible. Why delay the inevitable? Let's just amputate.
So we have a conference in El Paso. Probably you're going to talk about that. The whole objective of our conference is to spread the word that you should always look for a second opinion.
Yes.
You may get told by your doctor, well, there's no options, but there is always an option. You should look around, see a part of your body. You don't want to lose that before trying the best. And there is always somebody who can do a little bit more.
They say, Dr. Craig Walker, who I know is, just speaking today at this conference, he always says that nowadays, with the tools and techniques and the skill set out there right now, that you can get through 80 to 90% of the most complex blockages in the legs without having to resort to amputation. Do you agree with that?
I absolutely agree with that. Yes. There's so much advancement in the technology and the skills of this endovascular procedures we do, is that there is always a way. It's just one has to learn that. I mean, I've been to many, many places. Wherever I see where somebody's doing a different technique, I go and learn. So it's up to a physician how far he or she wants to go to learn. But yes, I completely agree with Dr. Walker. He's actually my mentor, and he was one of the first person I went after I finished my training to learn the peripheral vascular techniques.
What was it about what you saw in what he was doing? Because he was one of the pioneers way back when in a lot of these new tools and techniques, and he was willing to give things a try. What was it about what he was doing that fascinated you when so many other doctors in your class were saying, I can't be bothered. Amputation is so much easier. I can get that done in 10 minutes versus 3 hours of putting my own life at risk with exposure to radiation.
That's right. When I started my practice years ago as an interventional cardiologist in El Paso, um, I started as a cardiologist, but then I started noticing that, I fix the heart, but they end up losing their limbs. And I didn't know what to do about it. I tried looking around, and then I found out, why can't I learn this? I mean, if I can fix the heart, why can't I fix the legs? So Dr. Craig Walker has a program. I think it's been, I don't know, years. I went there about 20 years ago. And
Wow.
so he's one of the pillars and pioneers of this field. So I went, and he's very humble. He's very good friend, down to earth. And I spent 2 days there, and he taught me what can be done. What are the some basic things you can do? So when I came back, that's where I started. That was my base. And then I started learning more. I found out, well, there's a conference in Germany, Leipzig, and Laiq, and they're very smart, very highly skilled operators. So I went there. Oh, it opened my eyes. My gosh, you can do this. I came back, started doing that because I don't know. I mean, I never seen that. There is no major training programs teaching that. It's just learning from one another.
Yep. And now 20 years later, he is now holding a conference of his own. And we're going to hear more about that next, right here on the Heart of Innovation and how he is teaching others how to save life and limb. So don't go away. Okay. So just remember, it's pretend as if we are there at the conference today.
Okay.
So it's happening today. Because this is going to air on the radio
Right.
live that day. So okay, so this one is um about 8 minutes, Josh. That was great. I love this story. The only thing that we didn't get to, which I would love to hear you explain it. I always try to explain to people why it's so important to um, tell a doctor that you'd like them, or to make sure that a doctor before amputation will try retrograde. And I always explain it, and I could be wrong, as if you have you make a bowl of soup, you put it in the fridge, and then it ends up with a cap on the top. What if the plastic or the glass wasn't on the bottom and you could poke through? It's almost like mush. I explained it as the cap on the bottom isn't always as tough as the cap on the top.
That's
And I don't
correct.
know if you have a better analogy than
It's
that
it's,
we can
it's the
use.
it's the dynamics of the blood flow, which makes the proximal cap very hard, and that's where most of the time the failures are. And even you can get through to the cap, but when you come to the bottom distal cap where there's a reconstitution, again, this is hard, which is easily get through to going from bottom rather than coming from up. So the shape of the occlusion is more favorable going from retrogradely.
And I don't understand why more doctors, if that's the case, don't try.
Yeah, I still don't know. It's just crazy not to do that. And you can see still many physicians, they can keep trying for an hour and they have like 10 wires and then say, this wire is not good. Well, it's not the wire.
It's not.
It's you.
It's,
I give an example of like, you're driving a Ferrari and then you go and you wreck the Ferrari. Whose fault is this? It's not the car. That's a beautiful car. It's the driver, right? It's the driver. He's on the seat. He's in control, right? So he's a good driver. He will make the best out of it. Same comes with the tools. We have so many tools now available, but it's the operator how he or she's going to utilize those.
yeah. Okay, we're ready to go back in three, two. Hi, everyone, and welcome back to the Heart of Innovation. Dr. Phillips is off saving some piggies somewhere in the world. So today I am with Dr. Laiq Raja. We are at his CLIF, the Cliff Conference in El Paso, Texas, and I'm speaking there at the conference today. I'm so excited. I feel so honored to be asked to be a part of this amazing event for a second year, a very powerful event that is put on by the Limb Savers Society that is run by Dr. Laiq Raja and his team. I'd love to start this segment and talk about how you went from learning all these new tools and cutting edge techniques 20 years ago. You've been practicing it, you've been saving your lives and limbs of your patients, and now you want to get into starting your own conference to teach other people. At what point, what was the catalyst for you to say, you know what, I'm doing it and I gotta help others?
Yeah, it's a very good question. Because when I started practicing and started learning these techniques, I had to look around and find where I can go and where I can learn. And now I feel like with so many years of experience, I'm at that stage that I have to give back, especially to the young physicians who are graduating and they're very enthusiastic, they're very energetic, they want to make a difference in this world. But then they look around and say, where shall I go? So uh, I want to be available. And one of the ways to reach out to them is creating some sort of a conference awareness. And I've been working with many different industries, companies who are also very much committed to what me and my colleagues, they do. So they go out, reach out to different physicians who are practicing and see if they need any help. And then they connect them to us, so connected to me. I started doing trainings probably 10 years ago now. I've trained around 600 to 800 physicians who are all over the country and they are doing a
Wow.
super job. And we still talk with each other. And every time they have a success of very complex case. I get a text back, and I feel great that I was able to help somebody to be that state. Exactly like other physicians, Dr. Craig Walker, and all they did to me.
And we have a live studio audience. I always like to remind everyone, and we do have a question coming in from Marcia. Marcia, go ahead and unmute and ask Dr. Raja your question. She's trying to unmute. I'm guessing we might have to get back to Marcia on that, unless she can write it in the chat really quick. I'm not sure why it's not unmuting, but oh well. Okay. Well, we'll get back to Marcia and her question as soon as she can unmute and ask her question. So talk a little bit more about the CLIF conference, the CLIF conference in particular, and how that came about, because you've been all over the world and you've been teaching doctors at all these and future doctors at all of these different conferences. But what made you start one locally in El Paso, Texas?
Well, this part of Texas, we don't have any major peripheral vascular conferences. El Paso is probably around 80% Hispanic, and there's a very high incidence of diabetes and then diabetes-related complications, which is cardiac, vascular, and so we have so much population, and I felt like there is a need for awareness. There's a need for people to know what is available and what we can do. So I talked to my colleagues and we decided, well, let's start a conference called CLIF, Critical Ischemia Fighters Conference. I took it from AMP, one of other amputation prevention conference in Chicago. One of the things which is different in this, especially this disease state, which is peripheral vascular disease, is that you can't do everything by yourself. You need a team of people working with you to be successful. As a cardiologist, usually what we do is, we do a heart cath, put a stent or something, and patient goes away home next day or even the same day, and you are done. In this critical ischemia, peripheral vascular disease, a part of the work is vascular, which is opening the blocked arteries and all that, but actually it doesn't finish there. Then you need an infectious disease physician, you need a podiatrist, you need a wound care physician. So the purpose of this conference is bringing everybody together and giving an example, see how it really works as a team approach and multidisciplinary approach in treating these patients. We have about 4 years now in the hospital settings. We have a program which was actually accredited by a Joint Commission as a Center of Excellence for Peripheral Arterial Disease. And you'll be surprised to know that this is one of the 2 programs in the entire nation who've been approved and accredited by Joint Commission. So we feel very proud that we have achieved that status, showing that we have shown our data that for the last 4 years, we have decreased the amputation rate all the way down to about 3% major amputation rate. Nationally is about 15%. So the message is it works. Create a team, create your multidisciplinary approach, because if you work together, you can definitely decrease major amputations.
And you're not just talking because you're in an office-based facility, but you also have hospital privileges, correct?
Oh yeah, I'm a director of critical ischemia program in the hospital. I started that program. And so I run hospital and outpatient. The purpose is we can treat anybody. If they can be treated as an outpatient, we treat them outpatient. If they're very complex, they're very sick, we admit them to hospital. Or patient who comes to the hospital with this kind of a disease, they call us or my colleagues, and we treat them in the hospital. We have around 200 miles catchment area where we get transfer patients with CLI. All of my colleagues, the one who came and got trained with me, they have their own programs. Whenever they think they need my help, they call me and they transfer them here. And we, in the hospital, we have a navigator, we have a whole program. By the time they reach the hospital, everything is done quickly. So we have decreased the admission rate, the hospital stay, and all the good things.
And I love that those that you also trained, they fail. When they fail fast, and they refuse to lose. And for them, it means not giving up on the patient, but giving up the patient to someone else who has an even greater skill set for limb salvage. And that's you, Dr. Laiq Raja. And coming up next, right here on the Heart of Innovation, we're going to hear more about their limb saving program. So stay with us. Don't go away. Okay.
That was good.
Hey, that was really good. You're really good. This is awesome. We need to do more of this. Okay, so Marcia, did you want to ask your, I didn't know if you had your question, if you're going to want to, was that Lori? Or is that wasn't Lori, that was,
This was Adrian.
I was going to say that looked like Adrian. Marcia, are you going to be able to ask your question or no? Oops, do I need to unmute you?
Am I unmuted? Yeah, hi. If you want me to, I could just ask him now, or it's not that important.
Okay, because we could start the next segment. We can get your question.
Okay.
Yeah.
All right, thank you.
We don't mind. And if anyone else has another question, Heinz, do you have a question? We'll get to a few questions in this segment. Nancy, you do? Okay, so we'll get to a few questions here. And Heinz, if you have a question, just raise your hand. Okay, ready? Heinz, you always have a question. I know we're not going to get through this hour without you asking a question. Wouldn't be the same. Okay, ready?
You haven't clarified which one. You said 5 or 6 minutes in this segment?
5 to 6. It's flexible. Okay, are we ready? Thanks, Josh, for doing that. In 3, 2, hi, everyone, and welcome back to the Heart of Innovation. Again, Dr. Phillips is saving the piggies somewhere in the world, and I am in El Paso, Texas for the CLIF conference, the CLI Fighters Conference, where I'm speaking and raising the voice of the patient and sharing some of what the Global PAD Association does to help save life and limb. But they have an amazing Limb Savers Society in El Paso, Texas, started by Dr. Laiq Raja and his team, which is actually powering the CLIF conference, the CLI Fighters Conference. And before the break, we heard a little bit about how it works and how he even accepts patients from miles and miles away because his program is so effective. And they have, earned the designation of the Limb Salvage Center of Excellence? Is that what they call it, Dr. Raja?
Center of Excellence for Peripheral Arterial Disease.
I love it. And it's only one of 2 in the country. Do you know by any chance where the other one is?
I don't know exactly the name, but it's I think it's in Philadelphia somewhere.
Okay, fantastic. But if anyone is over there in Texas, you should be familiar with the Limb Savers Society and what Dr. Laiq Raja and his team are doing there. But we do have a live studio audience, and I want to get to a couple of questions. We have Marcia on the line. Marcia, go ahead and unmute and ask Dr. Laiq Raja your question.
We can't hear you, Mark.
Okay, I'm unmuted. Okay. Sorry. Hey, thank you so much for being here. I love your quote and your attitude and your methodology as far as caring for PAD patients. And my question is, listening to you trying to mentor and teach younger doctors, I wonder for somebody who maybe doesn't have a Kim that can lead us to limb salvage doctors, do you think it's better to go with somebody who's been around for a long time, a doctor that has more practice and more procedures under their belt, or somebody new and fresh, hopefully someone like that you're mentoring that maybe does know all the latest, newest, up-to-date treatments, but they might not have the experience?
Well, of course, experience, you cannot beat the experience. So from that standpoint, of course, if somebody has an experience, but then you have to see, is it experience for heart, or is it experience for what part or what kind of a procedure one person is experienced upon?
Do they have a lot more experience in bypasses and amputations, or are they trained in minimally invasive procedures?
Actually, you can also see the board certification. So there are board certification for endovascular procedures, just like interventional cardiology and other. So if somebody is board certified in endovascular, then you can see that this person has enough experience that he had taken the boards.
Excuse me, I think my point was, if they're not saving limbs and will just amputate and say that's all they can do, like, how does the patient filter through that, I guess?
Yes, I think going into one of the Googling and finding out CLI specialist. Now, there is a CLI Global Society. That's a really good resource. If you go to CLI Global Society and then ask the question, they will find out exactly who is where, and they can directly guide you towards the right person. I know it's hard, and not everybody knows about it. And it happens all the time that you don't know where to go and who to call.
So, and that's why the Global PAD Association actually has the pulse. You could be a member of the CLI Global Society. You may treat CLI, but you may not do it well. You have to also, there's a lot more even to consider, right? Where you have to look at the Medicare data, you have to see the results, you have to talk to patients and find out the outcomes. And I know that the CLI Global Society is working on their own database to put out there they want to have some sort of certification program, and that would help people to be able to better vet, the CLI doctors. But it's so tough to tell, Dr. Raja, because yes, you may be a CLI operator, but there are some CLI operators that the Department of Justice has even cracked down upon for doing too many procedures. And so it's like, well, yes, you might be able to do these procedures, but should you be doing all of these procedures? And there's so much for these patients to consider when making that decision. Gosh, what doctor do I choose? How do I know?
That's right. So it's a very sensitive and very difficult answer. I can tell you, I've been practicing in El Paso for 23 years, and your reputation, which really helps. Like in El Paso, everybody knows where to go and what kind of outcomes you're going to get. Takes a while, takes a time for everybody to know what you do, but I think you just have to keep working.
But coming up right here on the Heart of Innovation, I actually want to find out. Yes, everyone knows Dr. Laiq Raja. Everyone knows he exhausts all efforts to save limbs, but is there still resistance that he faces from those in the area who do prefer amputation over limb saving? We'll find out more next. Don't go away. Because I know that there are doctors that amputate.
Yeah.
And I know of another organization there that does way too many procedures.
I know. Exactly.
You thankfully have been able to salvage for me.
Because I think that the way I practice is I'm not the only person. I have a team. We work together. And the whole hospital system, we are part of it. So it's not that whatever I'm doing for myself. Everybody's together. The hospital,
Yeah.
the nurses, the navigators, and all. There's a way of figuring out what patient needs what kind of a help. So I agree. Now, I'm sure this is not live, right now.
Well, we're live. We're live online. We're just not live, so you can hold that thought until after we're done if you want. We are
I
live
mean, I don't
online.
want to talk bad about other people, but there are companies who are opening up the cath labs just to make money.
Yep.
You know,
We know some of those.
that's correct. So that creates a major problem for patients.
Yep. It really does. And just because we always tell patients, we just look at we're the only independent, like we're not a society based on doctors paying a membership. And just like you have the Society for Vascular Surgery, who now has their doctor finder and says you should only see a vascular surgeon for care, but the only vascular surgeons that are on their site are those who are members. But
Okay.
every member can actually be on the site. But does that mean that every vascular surgeon who is a member should be listed as someone that is a CLI operator that can treat PAD? So patient goes there, they see the doctor finder, they see there are a bunch of vascular surgeons in the area. How do you know which vascular surgeon actually spends the majority of their time performing CLI cases and saving limbs versus another doctor that may perform mostly, procedures for aortic dissections and maybe once in a long while performs a PAD procedure? You just don't know.
You are so right. You're absolutely right. We don't have an answer for that. Eventually, patients are the one who are like extremely confused.
I know.
Where to find, because they don't know. And if you look at the best CLI trial, which was published a couple of years ago, and in which they said, surgery, if you do the vein bypass, is better than endovascular. The failure rate of endovascular procedure was 20%, which is never heard of. My failure rate is maybe 1%.
Yeah.
So what are those people who are doing and failing, unable to do the procedure endovascular? They're all vascular surgeons.
It doesn't make sense to me. I had a couple doctors actually tell me they pulled out of the study because they didn't feel like it was so yeah. So I'm totally with you on that. And I deal with a lot of the same doctors in England that participated, and I know that they're not advanced skilled. There's a certain finesse with those tools that that you guys have, that you've learned, and I wish they would become more mainstream, and I wish people would take the time to realize that it's not just about pushing those wires as hard as they can. They deflect, they dissect, they perforate. I mean, they're everywhere. It's no wonder that you're sitting there and there's so many stents and people have jailed profundas and everything else that's just wrong. It's because it's not just about a wire. You guys are used to the most tortuous vessels, the twists and turns of the coronary arteries, small vessels. And on top of that, you're doing it in a moving target. I mean, it's just like, well, it's no wonder you guys are, interventional cardiologists do so well in a straight shot in the legs with some of the smallest vessels clear into the foot as well. So, okay, now let's go into this thing. I'll start out with the resistance, and we'll get into, I think Nancy has a question. Heinz does have a question. And we had a question from Adrian coming in from LinkedIn about wanting you to talk about DVA.
Okay. Yes.
You ready for me to start? This is 7 minutes.
Okay.
In 3, 2. Hi, everyone, and welcome back to the Heart of Innovation. Again, Dr. Phillips, my co-host, is off saving the piggies, but we have Dr. Laiq Raja here. We're at his CLI Fighters Conference, the Cliff Conference in El Paso, Texas, and we are talking about his Limb Savers Society, the Limb Savers Society. And before the break, we were talking about how everyone in your area knows your name, and you're there, you're trying to train everyone in the area about what is possible to reduce amputations and save life and limb in your area. But I have to imagine, because I've seen it, there is some resistance. There still are some practices there that favor some unnecessary procedures, and that includes amputations. How do you contend with that?
So I have to tell you my experience, my personal experience. In our El Paso, most of the amputations are done by orthopedic surgeons. Certain places are done by vascular surgeons, and depends upon that. So when I started practicing, doing a lot of peripheral work and all that, I decided to go to one of the orthopedic monthly conference. Because I just wanted to talk to them. And there were many of them, all the citywide. I went and talked to them about peripheral vascular disease and what happens when somebody loses their limbs, and what are the new techniques and technology available, how can we help. So after that, many of those orthopedic surgeons, they came to me and they said, you know something, we hate amputations. I said, what do you mean? But you do amputations? Then what do you? He said, when somebody calls me to have an amputation, I think that all the efforts has been exhausted. There is nothing else available, and they want me to cut the leg off. And I do that. I said, actually, this is not true. That depends upon the person who is asking you what is his comfort or her comfort level, or what is the skill level. Now we have CLI program in our hospital, which is a multidisciplinary. We have vascular surgeons, IC, everybody together. How about next time somebody asks you for amputation, you ask our opinion? So exactly what happened next time, there was a call for amputation. They call a CLI a consult. We went there, saw that, said, no, I think we can do this, we can do that, we can do that. So now at this time now, none of the orthopedic surgeons accept any amputation without our consent. This is amazing.
Wow.
What I'm trying to tell you is, it might be that they think that when someone is calling you because there's nothing else could be done. But we said CLI program or CLI committee, when we said that, yes, there's nothing else could be done, then I think this is the end of the road.
That's amazing. I went out with an orthopedic surgeon from our San Francisco Bay Area VA hospital. And I was telling him what I do with the Global PAD Association and all of the new tools and techniques that are available out there that the doctors we work with use. And he said, whoa, wait, hold on. You mean you can open up arteries in the foot? And I said, yes. And he said, oh my God, I always thought, again, exactly what you said. When the patient comes to me, that I assume everyone's already exhausted all efforts. So I just go ahead, don't question it, and I cut off their leg. And he said, I will never do that again. I will find someone that can do even what's called a deep vein arterialization, which Adrian on LinkedIn was asking about. Would you mind explaining that?
Yes, this is a new technique and procedure started few years ago, and recently it got approved by FDA. What it actually is that if we look at the patients who have a very advanced vascular disease, they may have absolutely no arteries left to open. And so this technique, what we do is we connect the arteries to the veins and convert the veins into arteries, meaning that now the oxygenated blood goes through the veins. Interestingly, veins, they never close. They never develop plaques. They never develop atherosclerosis, and they're always next to the artery. So some smart person, they found out, well, how about if we just connect this artery, which is occluded, to a vein? Of course, there's a lot of detailed work done. Very simplistic way, you convert the arterial blood into the venous system. Vein goes all the way down to the foot, and it takes oxygenated blood. And recently, the PROMISE 2 trial was published, and in which they showed that the patients who were 100% referred for major amputations, they underwent this, used to be called deep vein arterialization. Now it's called TADV, transcatheter arterization of the venous system. There was about 73% 6-month amputation-free survival, meaning that after 6 months, 70% of the people, they still have their legs. This is amazing. This is like we are pushing the amputation further and further possible.
And coming up next right here on the Heart of Innovation, we'll have some closing thoughts from Dr. Laiq Raja and some key takeaways. We also have another question coming in from our live studio audience, so we'll get to Nancy in just a moment, so stay with us. Perfect. We have one more segment that is 4 minutes, but I have...
Pick up the patient.
Oh, I'm so sorry.
It's okay. I have another case to do.
Okay, 4 minutes.
No problem. No problem.
Okay. Nancy, do you have a quick question? Because now you have to ask it since I already teased you.
Okay. It probably is partially answered, and I just wanted to know, what can we do as patients to bring a program like this to our area? Because my frustration is that we have so many amputations done here.
That's a good question. So we're going to hold that. That's a great way to close. Nancy, you're brilliant. So give me 1 second. I'm going to just start the whole thing. Okay. In 3, 2. Hi, everyone. Welcome back to the Heart of Innovation. This is our final segment. We're going to get some closing thoughts from Dr. Laiq Raja, who is holding, we are at the CLI Fighters Conference in El Paso, Texas, that's put on by the Limb Savers Society out of El Paso. We have a question coming in from Nancy in our live studio audience for Dr. Raja. Nancy, go ahead.
Thank you, doctor, for being here. I love what you're doing. What can we do as patients to bring a program like this to our area? I live in the Myrtle Beach, South Carolina area. We don't have enough doctors. There is a lot of amputations being done. So I'm very interested, and I get frustrated. Thank God for Kim.
Well, I understand, and it's very difficult issue here. For example, to have a good CLI program, you need a leadership. You need somebody who leads the program. And I think a physician, a CLI fighter, CLI specialist like us are the one who have so much passion that we want to start. When I started years ago, I was the only person, but then I have a lot of people, because it's contagious. The passion you have, you save limbs, you save lives, and that's how you create this program. Now, hospitals can help. Hospitals can create and help the physicians who are interested in developing this to have like a multidisciplinary physicians together to start this. And you should look for places where there is and get more advice. We are always open and for any advice, anything anybody needs to how can they start this program. It takes a little while, but I think it's worth it. I like to talk.
It literally starts with that commitment, right? It starts with the commitment that you want to reduce amputations and you're serious about it.
Right. You will go no matter how far it takes you, but your commitment is that you are going to prevent the amputation. And then you show it with time that, yes, we are doing this. And then you will see people start joining you. They believe in you and they start joining you, and then you bring a team. I'd like to talk a little bit about my Limb Savers Society, which we started about 3 years ago, because we see, if you really look into these patients with the CLI and severe vascular disease, many of them are underprivileged. They're undertreated, underdiagnosed, they're unable to see a physician, unable to afford medications. So when we are in it day and night, so we decided let's start a non-profit society, Limb Saver Society. Will get the funds so that we can treat these patients. So right now we have this. Of course, Kim, you are one of them. So how many times we reached out to you for help for our patients? And a patient of mine cannot have a transportation, we pay for their transportation. If they cannot afford medication, we pay for their medications. For housing, patient coming from out of town, we have Alejandra is sitting here, and she has arranged with different hotels to have different rates. So that's the purpose of the Limb Saver Society. How can we reach out to all these patients, and how can we help? And eventually it makes a difference.
And it's great to have a partner like you, locally, boots on the ground, making such a difference as you are. Thank you so much, Dr. Laiq, and to your entire team. And thank you everyone for joining us. For more information on the Limb Saver Society, what's the website?
What's the website? cliffconference.com.
Fantastic. Thank you so much. And I think the Limb Saver Society website is also the limsavers.org or the limsaversociety.org.
Right.
Perfect. Thank you. I'll edit that.
All right.
You guys are great. Go save some piggies.
Thanks,
I didn't
Kim.
mean to keep you for so long. Thank you so much. Thanks for you.
See you
I
on
can't
Saturday.
see you. I get it at 1:30, so hopefully I get to see you guys soon.
Take a picture. Kim, let me take a picture real quick, please.
Yeah.
I'll be picking you up with our
And
social-
I have a whole bunch of step counter watches I'm going to bring you guys.
Say cheese. Wait up.
Please.
Thank you so much. Thank you.
Thank you, Kim. Looking forward to seeing you.
Me too. Thank you for the honor of speaking again as well.
Bye-bye.
Oh, look, that's cute. Okay. Heinz, I just saw your question. I'm so sorry. Same over the years, as far as the same artery open every year for 10 plus years. And that's a really good question. And there's only so many times that you can really open that artery over and over and over again every year. And that's why it's really great. We have some new technologies that have come into play where they can bypass it using minimally invasive techniques using veins. But if your doctor is really using the most advanced techniques, which is truly tiptoeing into your vessel, trying to use as less trauma as possible, then you probably could do pretty well with it over and over and over and over and over again. But if you do keep having it over and over again, you really need to stop for a second and really reassess your care. There are some CLI patients that do need, it's just inherent of below the knee issues. But if it's above the knee and such, you got to really take a look at who's treating you if you keep having to get it done over and over and over again after 4 or 5 times. But you also have to look at what risk factors are you not mitigating, what other issues are you having that is leading to that.
So the reason why I asked that question, I had a arterial ultrasound recently, and believe it or not, my doctor, he called me on a Saturday to give me the results, and he said, well, if you're doing okay, let's leave it at that. But, if it continues and it gets worse, we might have to, he gave a few options, and there's more out there, I know that, but, ballooning or something like that. And he believes it's where the stents are. And I kept thinking to myself, okay, this would be like the fourth time that they're going back in there. I'm thinking to myself, how many times do they go in there? And I know I read on some of the forums that some people have said that every 6 months they go in and get ballooned in their artery just to reopen it. I don't know how many times they've had, but it seems like for some of them, it's like.
Yeah, they do have a lot. And we always say, if you are having a number of procedures, you should always just take a step back and always get, I don't care who the doctor is. And the best doctors will always tell you, you know what? Yeah, go get a second or third set of eyes on this. Maybe someone else is participating in a different study. There could be a different drug. There could be a different technique. There could be a different tool that someone is using somewhere. And not every doctor is able to participate in the new cutting edge tools and techniques and medications. It's just not possible because the FDA and even in Europe, they only involve a certain number of doctors. It's very controlled in those. And so if you are having repeat procedures, it's worth double checking and seeing if there are any new trials in your area, or if someone else just might have a different option. We have, someone who's been on here, and she was getting repeat procedures because her body was quick with its healing response. So even if the best of the best doctors were opening up her arteries, no matter what they would do, it would still clog up with scar tissue because she was young. The younger you are, the quicker your stents will actually clog up with scar tissue. It's what your body does, right? You end up with a scratch, your body has its healing response to heal that up, and you end up sometimes with a scar, right?
It doesn't help.
And
Radiation killed a lot of things in my leg.
yeah, and so that's also another issue when you do have, we see a lot of people nowadays where their oncology doctors never talk to them about what to expect down the road with potential radiation damage to the arteries, and the arteries become very friable. They're very fragile, and they're damaged, and so it's a very special case, and you do need to make sure that you do have doctors who understand the anatomy when it comes to these types of arteries that have been damaged by radiation. That's really important. You want someone with that experience who may have different options for you, may have different medications that could help slow down that healing response in your body, that it's triggering when you get something done. You might also benefit from, depending on where your blockages are, the new PTAB or detour system, where let's say your vein is healthy, that's right next to your great saphenous vein is healthy, and they're able to reroute blood flow through that vein through a covered stent across your thigh.
Well,
And then
this Friday I go in for a Varithena again. The one doctor, but again, my doctor, Dr. Aaron, and he said, if I have time, I'll come down and see, or come up and see me. So I was kind of thinking that in the back of my mind, what's left to do? PTAP? I kept thinking that, but I have a lot of trust in his decisions, and I understand what you're saying. You can always look and find somebody else, but it's not like it clogs up every 3 months. This was 2 years, going on 2 years, and I'm still.
That's pretty good. And you're walking and you're working on it. You're eating healthy. You're doing your part as a partner in care. Where what? I heard you earlier talking about salads.
Yeah.
I know you eat them.
Yeah.
You're not going to get away with that. Salads, even without dressing. I'm so impressed.
I just find it amazing that some of the people wrote in the forums that every 6 months they were getting their artery ballooned, and it was like a constant thing. And it's like, how often do you have to do that in your life?
Yeah, it really depends on the person. There are some people that are very hypercoagulable, and even no matter how much medication they're on, they still end up clotting. We do find that once they get the right cocktail right, we have Dr. Anita Dua, who's a vascular surgeon out of Mass General, that is doing some extensive research on the types of medications that are out there and the right cocktail for different presentations of peripheral artery disease. They've perfected it for the heart, but it turns out that with the legs, it might be a little different. And so she's looking at the different cocktails that and different levels of these.
I asked a couple times the doctors about the statins. I never had high blood pressure or high cholesterol or anything like that. I'm fine for the most part. I mean, as I get older, I'm sure there's going to be some clogging going on in different parts of my body because of age. But because, I keep thinking to myself, can I get off statins? It doesn't seem to help. I know it has this benefit for plaque and all that, but evidently I get more plaque in my legs. So is it really helping?
Yeah.
So I'm anxious to hear what she has to say eventually when her study's all done.
Yeah, because medication has done a lot to improve, situations with the heart and reduce the number of heart attacks and prevent unnecessary procedures. And so that's what they're really hoping again for patients with peripheral artery disease, and especially those that are hypercoagulable and those that end up with a rapid healing response. There might be medications down the road that are going to help improve the amputation rates and help reduce the number of unnecessary procedures, the revolving door of procedures that are out there that right now, many of them may be necessary to maintain the vessel open. But there's also, if you keep in mind, there are a lot of people that are also not as compliant as you are with walking as medicine. They don't push through the pain, the cramping. Everyone has a different pain tolerance. And so, one person may be able to push through and tolerate a little bit more pain than someone else. And so you might be growing more collateral vessels at a higher rate than someone else who may not be able to push through, that last step. Give me one more step. You can do it. You can do it.
Good point.
And that's what motivation, right? So we always say that those procedures, none of them are long-term.
Right.
They're all only to help give you that much more blood flow so that you can get just enough relief so that you can get out and walk and grow those natural bypasses. That's the point of these procedures.
I told Dr. Aaron the other day when he called, I said, I'm not stopping when I'm walking. I get the cramps, but unlike previously where I had to stop because it was unbearable, I'm not stopping. So that's why I'll have to hear what he has to say for options. But I hope to see him on Friday if he has time.
Yeah, but it's good. And I think that's a good way to end the live stream, is to really remind everyone walking is the best medicine. We see great stories every single day of people being able to avoid procedures, stop the revolving door, and also reduce their chance of amputation. So make sure you go to padhelp.org to find out more about our free walking program. We have a walking app and we have a text-based walking program that is free to you, and it's even free to your doctor so they can monitor your progress directly to create a more productive and satisfying conversation during those consults. So check it out. Also, don't forget, if you are watching on YouTube, please like this video and subscribe to our channel if you want to see more of this amazing content. I know on Wednesday we have another great doctor coming on, a doctor of physiotherapy, to talk about, speaking of walking as medicine, to talk about walking as medicine and to answer your questions about walking and exercise and how to improve your circulation. So thanks.